Hello everyone, I'm Dr. Francisco, a specialist nephrologist and transplant immunologist working at Francisco Kidney Medical Center in Singapore. Welcome to the Diabetes Health and Prevention video series. Today is time for part 9 on FreeStyle Libre. I hope you enjoy it. These talks are part of our efforts on health promotion, focusing on diabetes prevention and early detection. We also have two health enhancement programs, ARIS and JANUS, with the aim to achieve a better health and lose weight so you can become a healthier version of your previous self. If you are interested in knowing more or to enroll in any of these programs, call this number or visit our website at www.franciscokidneycenter.com. It is important to mention that Abbott is not sponsoring this video, is not paying me anything for the production of this video, and I also understand that in a way this is some sort of marketing for their product. I'm not expecting anything, but Abbott can continue sponsoring research in return if this video leads to more sales, or to even give donations to needy patients for having a better glycemic control. I'm featuring their product because it's a revolutionary product in the care of diabetic patients, achieving better glucose control and expected better outcome in the future. And as a consequence, I have it available on my center. Also, is the most widely available system in Singapore. Also, this video is not a manual. It is just an informative video. If you want to know how to apply this system properly, you need to follow the manuals or watch some other videos online that they have the purpose to teach you how to apply the system or use the device. Or you can consult me, or you can consult your doctor. So what is FreeStyle Libre? It is a device to measure glucose in the interstitial fluid or interstitial compartment. It is worn externally, typically on the arm, for up to 14 continuous days. You cannot put it on and remove it and expect the system still work. It also requires that the patient intermittently do scannings or flashing with this system. They just need to scan it through the sensor, and then that allows the system to capture the recorded data in the sensor back into the reader. This is how the FreeStyle Libre kit looks. Important to mention that also this system that you can buy separately has got some strips for finger prick glucose monitoring, so that you can compare what is your sensor reading to your blood glucose by finger pricks. After opening, it looks like that with all the manuals. Let's talk a little bit about the equipment. This is the reader, this is the sensor that is inside this package, and this is the applicator. The sensor looks like this. There is a small filament or needle that pierces the skin to go and measure the glucose in the interstitial fluid, as you will see in a minute. The sensor is a little bit bigger and thicker than a coin. There are two main systems, the so-called personal, that is the one I'm mainly talking about. With this system you can get real-time readings, but you need this intermittent scanning or flashing to get the continuous data. The professional system, you don't have this real-time readings facility, but continuously without need for scanning, it's reading the glucose levels in an unmanipulated, unbiased way. Maybe your doctor only wants to get your profile to, for example, diagnose prediabetes or something like that. Then, or for research purposes, they can use the Pro system. But if you really want to know how's your sugar after eating, after doing exercise, after injecting insulin, you will need the personal system. So how does FreeStyle Libre works? I mentioned it has got this filament that pierces the skin and goes into the interstitial compartment to measure the sugar, the glucose in the interstitial fluid. But we also have the blood vessels. The finger pricks measures the sugar at this compartment. But let me explain this. After you eat, the sugar is digested in the stomach, intestines, and gets absorbed into the blood compartment first, and then from the blood compartment goes into the interstitial fluid to be utilized by all the tissue cells. So it goes first into the stomach, then into the blood vessels, in stomach and intestines, then into the blood vessels, and then into the tissue. So it takes time to go all the way here. This is important for you to understand the lag phenomenon that we'll talk in a minute. Before that, so BG means blood glucose, the sugar by finger pricks, and SG means sensor glucose, the sugar by this system in the interstitial compartment. As already alluded to this is the direction of glucose. It increases first in the blood compartment and later in the interstitial fluid. When the sugar levels are stable, for example, in fasting or many hours after a meal, they will be comparable. For example, you can see the readings are not that different, but can be sometimes even up to 1 unit or so, 5 in one system, 6 in the other. But when the glucose is changing rapidly, for example, after a meal, especially it's a large meal, or after injecting insulin, the levels could be totally different. For example, after a meal, because the sugar goes up first in the blood compartment, so you expect a higher level in the blood than in the tissue if you measure at the same time. The opposite happens when you inject insulin. It drops first into the blood compartment and later will equilibrate, moving the sugar from the tissue to the blood, later will equilibrate. But at that time point, if you measure at the same time, it will be lower in the blood compartment and higher in the tissue because it lags behind. This is the lag phenomenon. This is very important that you know, because if you are using insulin and you get a low reading, in the blood compartment can be even lower. So if you get a low reading in the sensor, you are obliged to check by finger prick using the FreeStyle Libre system or other device you have, because it might be lower, so you can do the proper correction. So this is very important for you to know. But FreeStyle Libre allows you to identify what is the trend by an arrow system. They have an arrow after you flash the system and you get a glucose reading. There is an arrow next to it that tells you what is the direction of the sugar. So maybe we will be totally up or going up like in a corner or to the side, or going down in the same fashion, totally down or to one side. It indicates how fast the sugar is changing. How they can predict that or how fast the sugar will change? Because they are measuring continuously the blood sugar. So if in the previous readings, after you scan, the sugar was, let's say, 5, the next reading was like, automatic reading was 6, so meaning the sugar is going up. So you expect now after flashing your reading is 7, meaning the sugar is probably rising too fast, so it will show an arrow up. So it's kind of a prediction. It's fairly accurate. So the opposite if it's going low. But if it's stable, the arrow will be to one side. So how you apply the system? I need to mention again, this is not a manual, it's just informative. This is how the sensor on box look. When you open, the sensor, remember, is in this package. This is the applicator. You will need to align them together to arm eventually the applicator in this way. The sensor from being here moves into this device, the applicator. So now it's armed. You can see the filament or needle there. Just I zoom it here so you can see the filament in the arm applicator. Then after you clean, the skin with the alcohol swipe, then you just place it on, push it up, like here, with the help of your healthcare provider, and the sensor will be put in place because it's got a sticker, plaster, and it will look like this. after the end of the period, after removing, should look like this. But remember, it has got a little filament or needle, so you should dispose it properly to avoid anyone gets an accident with it. So how you scan the sensor? So after you open the package, turn it on, has got already battery charged, you flash it for the first time and this screen appears. You need to wait 60 minutes, so kind of to link together the sensor and the reader. Remember, this is the reader, the sensor is the small capsule, yeah? After the 60 minutes, this screen will appear. Now you can scan the sensor. You scan it. If that screen doesn't appear, it will be the main screen, so you need to press check glucose. And then this screen will appear and you scan it. Scan it over it. You can also do it over the clothes, and then you get your first reading. The units will depend on which country you bought the system, and the units your doctor used there. So the system gives you, importantly, the reading in real time, the arrow I mentioned, and also measure the readings over the last hours. This is continuous data. Just let me go through briefly with most of the features of the reading screen. They have some things like messages, a touch pad to add notes, for example, when you add, like here, a footnote, or when you apply the insulin, for example, battery life, the sensor status. But the most important are the following three. That is the actual reading, the arrow indicating the direction. In here, for example, the sugar is increasing, because it was probably the baseline, now went up, and this reading, so expect that the next reading will be up, maybe after a meal. And this plot that tells you the continuous data. You read here, maybe you went for dinner, and then you realize this is how your sugar went up, so you realize if that was a healthy dinner for you or not. So that's the importance of this screen. There are other screens. For that, you go to the main screen, you press Review History. I'm not going to show you all the features, but just some of the main screens. This is the daily graph, similar to the other screen, but this one is the whole 24 hours during the day. You can see how your sugar went after breakfast, after lunch, after dinner. Also, the average glucose there is another screen for that. There is another screen to show you all those readings that you flashed. If you flash only 4 times in a day, you only have 4 readings there. You flash 30 times, you will have 30 readings there. Also, the time in target, so to know if your sugar control is most of the time okay. And this one is also important because it's the summary for example, in this case, the last 7 days. What we want as a doctor, besides that you get the convenience, you get these real-time readings, we also want to eventually calculate statistics of all that continuous data for up to 14 days. So all the days will be lumped together and give us kind of an average readings or spread readings to tell us at what time of the day typically your sugar goes up or down. For example, in this case, this is where the sugar usually goes a little bit higher, yeah? But I will talk about that in more detail in the next video. So let's talk about the convenience of FreeStyle. You can do it when you're going to work, when you are actually in the office at work, when you're in the park, when you are commuting in the metropolitan train. This is myself that I decided to test the system. So to be able to advise my patients better on them, I want to test some hypotheses. I wanted to see how it feels, to see the durability, when I play sports, when I sweat, when I swim, etc. To recommend better my patients, or if I encounter any troubles, to be able to advise my patients better on this system. When you are on the beach, this slide can be misleading because you can think that you can take pictures with the device. You cannot do that. It just shows that you can be on the beach or you can be on your dream holiday and you can get still your readings. And so this could be an important feature, because maybe you go on a cruise, you go to your dream holiday, and you still are concerned about trying to maintain your sugar okay. You're going to eat totally different food, so you can bring this system and then control your sugar better when you are on holiday and you are more prone to eat nice food. Yeah. So, and maybe patients are using the finger prick monitoring, but could be a good use of this system when their lifestyle changes, like on holiday. They might not need to use it back home, but they can use it on these periods. That's one of the potential uses. Yeah. So when children go to school, try to find ways to make it trendy for children, or for people to look cool in the gym, or funky when they wear it. Find other ways to make it cooler with different sort of ornaments and screens or protective cases. Yeah, but we have just talked a little bit about the convenience. That is one important feature of this product. We will talk about the performance in the next video. That is actually the most important feature for the care of patients, and that's why I like the system very well. But let's talk about some issues. So overall, I think has got more advantages than disadvantages, but indeed, no system is perfect. So let's talk about the issues I have encountered. Indeed, it's not totally discreet. If you are very confident and you don't mind other people to be aware that you are wearing it or you are diabetic, so you can just use it like this person. But if you like your privacy, you prefer others not to know your condition, that's totally fine. You can basically just cover it, either with a longer sleeves or using the system that you would think that this person just practicing sports, correct? Having, sensors with different skin tones could be useful. There are also some minor moderate issues. One could be allergies to plasters, that just, you don't know how so many people just have an allergy to plaster. There are methods to try to avoid that this becomes a problem if the patient still would like to wear the system. You can put this over a plaster that you're not allergic to. You can consult me if you want to know more about it. Unfortunately, it comes off more often than Abbott promises. So meaning, usually you don't get those 14 days profile. I have tried on many patients, relatives, myself, friends, and I think only one has completed the 14 days. Has come 4 days, 6, 7 days, 11 days, quite a few of them. Also, it probably depends how your skin reacts to the plaster, but also how active you are. For example, I practice sports, do exercise, go to the gym, so I sweat a lot. So also, if you accidentally get knocked on a chair, so it can come off. So, but probably they can put a little more effort on making more sticky without really becoming more allergenic. Yeah. So, but knowing that Abbott has a good customer service, they usually replace the sensor in a couple of days in case it comes off and your doctor cannot get the profile. For example, one patient come at 4 days, I couldn't get any useful data to get a profile for the patient. They kindly replace the sensor with no cost. Also, there is a minor risk for infection. Even you clean the skin, because you are piercing the skin with a needle. Also, the cost issues. As I mentioned in the previous video, the system head-to-head compared to the finger prick system is more expensive. But maybe many patients don't need it for all the time, it's only for time points, like when you want to get a profile to be sure the therapy, the diet is okay, you can get a profile and do manipulations. So, or some patients, the convenience is very important, so they find, yes, economical cost, but their lifestyle, their quality of life becomes better because they don't need to do the finger pricks that probably they hate. So every person has got different priorities. I'm just trying to be objective. I'm telling you, you should change the system. We alluded before what is the answer to that question. You are now reinforcing that answer. The answer was depends on your priorities. If convenience or performance is your priority, you can consider this system. And not everyone really need it. That's why I made allusion to those. You might use it when you go on holiday, or you might use it when one aspect of your medical condition, your general health change, or your doctor changed medication. So just to be sure everything went back to a better, stable profile. Yeah. So indeed, there is some inconsistency with other systems. You measure the sugar with two different devices. It can be totally different, especially if the sugar is changing rapidly. For example, after injecting insulin, after a meal, or simply because they are measuring first two different things. One might be measuring blood sugar, like finger prick, and the other one measure the interstitial fluid. So it's the same sugar, but in different compartments. So you expect some difference, especially if it's changing rapidly, you expect bigger difference. So it's important that you know this, that you know the lag phenomenon to understand this and not just say that it's not an accurate system. This system probably measures accurately the interstitial glucose. This system measures accurately the blood glucose. But obviously every system has got some degree of error, 10% or so, yeah. There are many other systems different from FreeStyle Libre, from this company. If you are familiar with them, if you know about them, if your doctor is familiar in using the system, you can consider this. My general view, at the end of the day, it doesn't matter what system you use. If you use FreeStyle Libre, you use this other system, for example, called Dexcom, or you continue using finger pricks. What is important is that you monitor your sugars in the way your condition needs. If everything is stable, you have diabetes on diet, maybe you need to do occasional readings, maybe occasionally do one ambulatory glucose profile. If your diet is not very good, you're having high doses of insulin, your doctor tells you you need to improve many things, probably your disease will benefit for getting a better, a more, detailed information on your blood sugar control. Maybe you will benefit from this system. Just another slide on that. So let's talk about other that I have called more significant issues, because it can be more impactful to lives of patients, not necessarily more severe, damaging the patient, but the occasional requirement of pinpricks when there is hypoglycemia is an important issue that we need to address, as I already addressed before, because it can be dangerous if you have a level of 4 and you don't take action when after you need the insulin. Maybe your insulin is already 2.9, and if you don't have awareness of your low sugar or this on awareness of hypoglycemia, you can be in danger. So you need to know what you need to do, and then you need to go back to the finger pricks. But it is just like that. But if you are encountering this problem, then you should tell your doctor that you are going low and you need to correct it with extra food. So the doctor can probably adjust your insulin regimen, advise you in more detail about your diet, etc. But this is very important to know. But some patients, it could be like an issue saying, oh, I still need to go and do the pinpricks. Unfortunately, you still need to do it in many occasions. But then you get a lot of important data and a lot of other benefits from this system. So there can be occasional, this is what I just alluded, there can be occasional sensor malfunctions. You sometimes have this screen, and usually if this happens, although it tells you wait for 10 minutes, happened to me, and eventually the sensor didn't work. So, but as I mentioned, you can just call customer service and they can replace it for you in a couple of days. The fact that it requires intermittent flashing is important if you are missing the flashings, you are missing the scannings, because means you're not going to get data. At the end of the day, you're not going to be able to produce this plot I just show you. I'm not going to be able to calculate the statistics or interpret the statistics that the software calculates for me. So in a way, it will be wasted, the effort, the sensor, the money, etc. So it's very important that you do these intermittent flashings, because if not, you will find that suddenly there is no data here because it took more than 8 hours between two scannings. Yeah, and also there is a risk of undercorrection of insulin when the, or overcorrection of insulin when the levels are changing fast. So that's why you need to be coached with your doctor. I can also coach you, or as I coach my patients. So just briefly, let's talk about the performance. Eventually, you get this plot and many other statistics that are analyzed automatically by their software. I have been trained. I attended live lectures course by an expert in the UK and some online modules, so I get trained and a certification to be able to utilize this system to talk to you in this way, to train other doctors, dietitians, nurses on this system, to report this system for other doctors that would like, they don't have it available, but I can get a reading, a report for them so they can manage their patients. And I'm planning to do a workshop on that for professionals. These talks are mainly dedicated to general population and to patients. But this is the performance. This is what we call the ambulatory glucose profile. What we've been talking just now is the ambulatory glucose monitoring, how you monitor your sugar with this device and all the benefits and cons of that. But now this is the performance. You get this profile and many statistics that your doctor can use for better control of your glucose. But I will be talking about that in the next video. So stay tuned for that. Stay tuned to know also more about Aries and Janus, our health enhancement and weight management programs, in tune with all the topics of this video series. I have tried them myself, and indeed I have almost lost 4 kilograms of weight. So I have received a lot of benefits. Not only that, many other benefits for being included into these programs. So that's why I'm trying to share this to you, so that you also receive those benefits. In a way, getting probably a better health for the future, to be able to live my dreams and to stay for as long as possible with my loved ones, with my children, with my wife, etc. So every person has got different priorities. Some people want to complete a career, to lead to a successful business in the future, to travel the world, to have many relationships. Whatever is your priority, if you stay healthy, you are more likely to achieve that in the future and also achieve it in a better way. So stay tuned for that. Subscribe to our YouTube channel. Share these videos. Maybe you know it. Maybe you are already healthy, but maybe your friend, your relative can benefit from all these talks. Please share them. Okay, thank you for your attention. Take care. Bye-bye.